Good afternoon and welcome to my presentation on the treatment of post-traumatic stress disorder in combat war veterans. During this presentation, I will propose an evidence-based project that I've constructed due to my observed experience within the Veteran Administration with combat war veterans, based off of the research that I have done in regards to this topic. As a psychiatric nurse with the Baltimore VA, I've experienced many clients who've been diagnosed with PTSD. They're often prescribed with medications for this disease, and yet few of them regularly attend therapy to further combat the psychological component of the disease. This observation and experience kind of guided my research to formulate this evidence-based project. So recently, the VA has been under fire due to the alarming statistics regarding suicide within the veteran population. Currently, the national average of suicide in veterans is about 2 times that of civilians. The U.S. statistic is 19.4 suicides per 100,000 versus the veteran statistic of 38.3 per 100,000. PTSD is a known common risk factor for suicide due to the symptoms experienced by veterans, such as sleep disturbances, anxiety, depression, irritability, and often substance abuse and addictions, all impacting their daily lives. That being said, many veterans are not able or not seeking help in regards to their mental health. In fact, only 40% of veterans diagnosed with a mental illness are seeking treatment in the United States. With that all being said, there's a lot of improvements to be made within the VA system in hopes to improve care for the veterans. So what exactly is the available care available for PTSD treatment? There are numerous pharmacological and non-pharmacological interventions. However, the focus of this project is prazosin and cognitive behavioral therapy. Prazosin is an alpha-adrenergic blocker, which helps treat both nightmares and sleep disturbances, in addition to anxiety in those who suffer from PTSD. Cognitive behavioral therapy is a psychotherapy targeted at changing patterns of behavior and thinking within the client. So after conducting some background research, it was found that both of these treatments individually are very effective in improving outcome measures for those diagnosed with PTSD. However, it was really difficult to find research combining these two modalities versus a usual care population. That kind of helped formulate the initial steps of my intervention. Additionally, in constructing the intervention, I wanted to improve accessibility for the veterans due to the alarming number of veterans not seeking treatment. So with this solid foundation of background research, I was able to construct my proposed project. My intervention will begin in office with a psychiatrist or therapist would recruit a veteran based on their diagnosis with PTSD and who have been prescribed with prazosin but are not currently in a CBT program. Those clients would therefore be referred into the 6-week program that I have initiated. They would be excluded if they're medically unstable or currently are in a CBT program and or have a history of treatment noncompliance. That can be specified by 3 missed psychiatry appointments in the last year. The design of the CBT intervention is based on a 6-week program. Typically, CBT is 8 to 12 weeks. However, the VA has actually created a guide for therapists to provide an accelerated version, which only takes 4 to 8 weeks, in order to improve compliance and accessibility. Pre- and post-polysomnography tests will be obtained at the Baltimore VA Sleep Center to track sleep improvements. And additionally, the client will meet with his or her psychiatrist at the 1st, 3rd, and 6th week mark to ensure appropriate medication regime. And that's when the outcome measures will be rated and recorded for data. The measures that will be recorded by the psychiatrist include the Pittsburgh Sleep Quality Index, the Clinical Administered PTSD Scale, Patient Health Questionnaire, the PTSD Checklist, Concern About Life and Family Disruption Scale, and the Hamilton Depression Scale. All this data will be documented and shared with the research team via the electronic health record, and mean data before and after intervention will be taken and calculated along with the standard deviation and confidence intervals. It is my hope, after feeling the positive effects of CBT, more veterans will continue this therapy to cope with the trauma that they've experienced, and they will have the option to continue with this therapy or end it after 6 weeks. So to conclude, through early intervention and comprehensive treatment plans, advanced practice nurses have the ability to help veterans lessen the impact experience in combat has had on their civilian lives. By providing more comprehensive care on a small scale, in time, hopefully the suicide rate in veterans will decrease. Thank you.